When you probe into that, I feel like these things come in tiers. So there are medicines like Skyrizi, drugs for psoriatic arthritis, the GLP-1 weight loss and obesity medicines.
Full disclosure, Skyrizi ads have actually appeared. We've heard them on Bloomberg.
Oh, okay. We
Right?
have. Yeah, Skyrizi.
Right?
Yeah.
We just want to point it out.
I can't watch the NBA playoffs without being like, I've memorized the jingles to these medicines, which I won't subject you to. I think ethically as a journalist, I couldn't recount it. And also ethically as a radio program, we shouldn't subject people to my singing voice. But to your question, there's those medicines which have a sort of, there is data showing that prescribers are more likely to prescribe them if the patient asks about them. And so you can imagine the feedback loop by which you put them in the minds of the patient. And if they have, for example, psoriatic arthritis, which is a fairly common disease, then there might be something there. So that's one tier. You go below that, and we were just seeing on one of the feeds here an ad for Keytruda, which is a cancer medicine, which, you know, cancer is fairly common, but it's much rarer. And these are rarer genetically defined types of cancer that it treats. It's hard to imagine the patient who would be exposing his or her doctor to the most widely prescribed cancer drug after seeing it on television.
Like if you have cancer and you're talking to your oncologist and you say, hey, doc, I saw this ad for Keytruda. Why don't we try it? And the doctor's like, wait a second, that's a really good point. Maybe we should try this as part of your treatment plan. Maybe get a new doctor.
Yeah, you as a patient should perhaps consider things. But it is part of this ecosystem. Like I said, there is data showing a correlation.
But to be fair, I mean, I think we're assuming that all doctors are up to date on the latest and greatest.
But I guess if you're seeing a specialist who is prescribing the type of medicine, because you have a condition that Keytruda, this specialized cancer therapy, would treat.
Can we assume that they would know about it?
I hope we can.
Okay.
I mean, in that case, you'd be seeing an oncologist, which they should be up to date on all of these things. But
different oncologists specialize in different types of cancers.
Sure, and there's community center oncologists who maybe are not attending each conference and subscribing to all the relevant journals. I think what's interesting is, like I said, in the more common diseases, like for psoriasis or psoriatic arthritis, what we know is there's a lot of switching in that market. Patients respond to one therapy, stop responding to it, get switched onto another, their insurance pulls it, whatever. And there, I think the concept of brand marketing actually sort of makes sense in the way drugs are marketed in the United States.
Does it help drug companies keep their drug going even after it's off patent versus generics? Like if you constantly see the commercial, you're like, well, I want that one. I want the brand name. I don't want the generic.
Very much so. We've seen data in the past about how drug companies will escalate their advertising spending toward the end of the patent life of medicines because they know that generic competition is coming. And if a patient goes into a doctor's office and says, I want, let's say, just brand X, to not like paint anyone with a broad brush, the doctor may be more likely to prescribe the brand name than the generic because it was asked for.
Interesting.
Okay, so let's bring in what Bloomberg News reported earlier, that we could start to see a wind down here of this. Obviously, it's a big market when it comes to advertising. What do critics say is wrong with the industry?
In terms of blanketing the airwaves with these things,
Correct.
is that it can contribute to a misgotten idea of the safety and efficacy of these medicines. You watch a 30-second spot of a happy middle-aged couple throwing a ball back and forth. Maybe that's a little too Norman Rockwell, whatever. And then at the end, don't take this if you, et cetera, et cetera, et cetera.
Yes.
That can contribute to misconceptions of actually how these medicines work. I think what we understand, what my colleague Rachel Corzang reported, is that the government is looking at two potential ways of reining in these advertisements, both of which have been floated before. One would require Congress, which would be passing a law that stopped pharmaceutical companies from claiming as a tax deduction the business expense of these advertisements.
Okay.
Which that, I've been told many times, is probably a non-starter legally, because if you think about it, every company doing business can write off its business expenses, except this one, which is very strange and probably vulnerable to a legal challenge. The other, which the FDA could do, I don't want to say by fiat, but would be an FDA policy, probably would also get them immediately sued, but would be to change the rules of those safety disclosures at the end of the ad. Instead of saying, I think they have to list the top X number of safety issues or common side effects and then point to a website or somewhere where you can get more information, they would instead require them to list all of them. Which is to say the ad could be 4 minutes long and be mostly just a disembodied voice telling you that you could get shingles or whatever from a given drug. And so the conception there, I think, is that it would kind of bully drug companies into stopping doing that, or instead doing what they call disease awareness ads, where you don't mention a drug or a brand name, you just say,
I've heard
talk
those
to
with
your doctor.
celebrities.
Yeah.
And then at
Dry
the end,
eye
it's like,
disease, yeah.
and then it's like, this is brought to you by this large drug company. And you're like, wait a second, they must make a treatment for this.
Exactly.
Yeah.
But as long as you don't name the brand of the
treatment.
drug, you
Okay.
don't have to go through the
That's
rigmarole.
interesting.